So let's talk about the rest of the skin. So this part two, all right? The next part of the skin that's deep to the epidermis is a dermis. Now the dermis is going to be divided into two layers, the papillary layer and the reticular layer. The papillary layer is very small, right? It makes up the top 20%. This papillary layer is the region that kind of moves up into the epidermis, right? Remember the epidermis, this region right here is the junction between the epidermis above it and the dermis below, right? You have a basement membrane here separating the epidermis from the dermis, right? Now, the dermal papillary layer, sometimes just called the dermal papilla, is the layer of the dermis that moves up into the epidermis, giving you this up and down undulation, right? This papillary layer is pretty small, about 20% of the dermis. We see lots of areolar connective tissue here because the areolar connective tissue, we saw through the microscope, that areolar connective tissue had lots of open space. It's not just clogged with lots of cells and fibers, right? Because there's lots of open space, there's room for blood vessels to be found in this area. Now, the dermal papilla and the up and down undulation gives us the patterning we see in fingerprints, the whorls that we see in, right? It's caused by the ridges. Now, the deeper layer, the reticular layer, deep inner layer, makes up 80% of the dermis. This is where we see incredible amounts of dense, irregular, collagenous connective tissue. Also where we see a little bit of fat, but more importantly, lots of hair follicles, lots of nerves, not lots of glands for sweat and for sebaceousness, all right? Oil glands that allows you to make your skin supple. So then your hair on your arms and hair on your scalp, make it nice and not brittle, right? So let's take a look at this area right here. We're just gonna take a look. So the papillary layer is this area and above with lots and lots of areolar connective tissue. Then, right, deeper here, which they should show more, but they don't, right? Then you should see the layer that's the reticular layer, right? Let me see if I can find a better picture of it. I think at the very beginning, there was one. Yeah. So interdermis, the layer on top, right? That's a right papillary layer up here. And then the rest right here is going to be the reticular layer, where you see a lot more of dense, irregular, collagenous connective tissue there for strength, right? So then you don't rip the epidermis from the dermis. Now, when we look at the skin, there are times when you might need to have stitches or have surgery done, right? When we are having to do surgery, we want the best process for you after surgery to heal and hopefully heal without scarring. So what we're going to do is follow what we call tension lines. Now, the tension lines follow the overall patterning of the muscle underneath the skin, right? So tension lines are formed by elastic and collagen fibers oriented more in some directions than others. The direction is usually aligned with the movement in that area. What do we mean, right? Take a look at your arm right here, right? Your arm right here, right? Anterior part of the arm, your bicep muscles over here. If you move your bicep, it causes your forearm to move up. That's that up and down movement, right? That's naturally seen with the biceps. Well, it kind of makes sense that the collagen fibers run along that same length of the muscle. So then when the muscle moves, right, the skin moves with it. So that kind of, line that we see here is the way that the collagenous connective tissue is laid downwards. And it allows us to have a patterning effect. So then and it usually follows the movement of the muscle deep to that skin, right? Now, the cleavage lines are important for surgery. So if we have surgery and mom needs to have a C-section, right? We don't cut up and down vertically. We cut horizontally and then find the uterus and then get the baby out, right? Well, the thing is, when we cut horizontally like this on the anterior abdomen, we follow the cleavage line. And what happens then? Following the cleavage line means that when we suture it up, there's less likelihood of having big scars. Now, sometimes these suture lines, right, and cleavage lines aren't that effective, meaning what, right? You do a lot of working out, and now your biceps are much, much bigger than they were before. Well, because they're so much bigger, it causes the collagen fibers in the skin to stretch out a lot. And now we have stretch marks that are seen, right? Due to either working out too much and the muscle enlarges and the skin has to accommodate that larger muscle. And the only way it can do that is to stretch. Or you have a baby in utero and now the abdomen's growing pretty large, causes stretch marks to occur in the abdominal region as well. Now the subcutaneous tissue is the deepest layer of the integument. It's made out of a lot of fat, consists of loose connective tissue of collagen, lots of elastic fibers, and lots of adipose cells. This is also called the hypodermis. The blood vessels here are very large. Because they're so large, when we introduce medicines here, they have greater ability to be picked up into the bloodstream and be incorporated into your blood, right? That's why we have these subcutaneous injections that are very common. Now, in terms of function, energy source, insulation, padding, right? In terms of the, the skin, the epidermis, the function we're going to see, right? Protection. It allows you, in a second, we'll discuss how the hairs, the sweat glands are also protective. The dermis region right here is where we're going to see a lot of sweat glands, right? Some that empties into the hair follicle, some that empties directly to openings or pores found on your skin. You also have lots of dense, irregular connective tissue here. So then the epidermis has a little bit more strength as well. All right, skip the hair. The only thing I want you to review the hair is just when we see it with hair loss, right? Because it does happen in females and males. Regular hair loss is normal, right? Doesn't mean you're balding, right? Most of the hair will be replaced due to active mitosis. The male pattern baldness usually is seen due to increase in amount of dihydroxytestosterone, right? This is a very potent type of testosterone, and it causes the cells that help form the hair follicle to die off. Females with polycystic ovarian disease, right, will have increased amount of estrogen, which then gets converted to DHT as well, right? Now, in some of them, they can get the male pattern, right, baldness, and because you have increase in testosterone, they actually have increased hair growth in certain regions that we usually see in males. The erector pili, smooth muscle found on the deep in the hair follicle, and it allows you to contract the hair follicle so then it stands straight on end, right? As it stands straight on end, you have the goosebumps feel to it. And we believe that is actually protective, right? And when you have the hair, even though the hairs aren't very long, they're sticking up, right? If somebody's trying to grab you, maybe it hits the hairs first, kind of allowing you to give the message to move your arm before you get grabbed by somebody. We believe it is part of our fight or flight response. So then you do have that maybe an extra millisecond before somebody grabs you, right? That you're able to move your limb out of the way. All right, know the type of glands: sebaceous, ceruminous, sweat, even mammary glands, right? Now you don't need to know exactly what they do, know things that I have highlighted in red. Sebaceous glands are types of whole occurring glands. Sebaceous glands are over here. Cells produce the content. Then the cells that produces the content dies off. And then a combination of dead cell and the content gets moved into the hair follicle. Now, the secretions here are really oily. And this is the reason why if you don't wash your hair for 3-4 days, the hair gets oily and shiny, right? And usually that's actually a good thing, right? Shiny and oily hair is protective. It prevents breaking of the hair follicle right here. So the problem normally will be if you have an issue, right? An issue with the secretions.